Next on Sisterhood of the Second Act.
There are several reasons why a woman may find herself suddenly single later in life. The death of a spouse or divorce come to mind. According to the National Center for Marriage and Family Research at Bowling Green University, since 1990, the divorce rate for people 55 to 64 has doubled. Kathryn Matherly from the Financial Empowerment Center in Roanoke City is here to tell us how we can stay financially healthy so we can handle whatever life throws at us. And during the pandemic, Dr. Cynthia Morrow was a regular on local television. She provided us with the information we needed to stay healthy during the pandemic. And as the director of the Roanoke City and Allegheny Health Districts, that's still her job, even though COVID isn't making the headlines. So what did the pandemic teach her? How has it impacted public health procedures? And are there some instances where we should still wear masks? She'll answer those questions a little bit later in the show. We'll meet both of these women on this edition of Sisterhood of the Second Act right after this.
Looking for your first home or retirement home? Realtor Monica Nicely can help you find it. Whether you're moving in or out of the Roanoke region, call Monica 540-449-2019, 540-449-2019. Alcova Mortgage Loan Officer Jonathan Sweat helps you seal the deal with the loan to suit your needs with great rates and terms. Call Jonathan 540-314-8843, 540-314-8843.
Alcova Mortgage, Equal Housing Lender, NMLS ID number 40508, MLSConsumerAccess.org. Terms and conditions apply. All loans subject to credit approval.
I'm going to be an oak tree.
I think I'll be a dogwood tree.
My kids say they be looking for a thorny tree from me.
With Evergreen, you can be a tree. Our biodegradable urn combines your ashes, natural soil additives, and a native tree of your choice. Be a tree and grow for tomorrow.
I want to be a tree.
Learn more at evergreenmemorialtrust.com.
Cabby Fashions take you from the boardroom to the beach. Dress for a garden party or a night on the town. Independent cabbie stylist Darlene Marshall will make sure you look your best no matter what the occasion. She'll bring the store to your home for you and your friends or schedule a private consultation. Call Darlene 540-330-6819, 540-330-6819, or find her on Instagram at Dapper Darling, on Facebook at Darlene Marshall Independent Cabbie Stylist. Pat Lucas is committed to providing independent financial advice to help women and their families save money during this tax season. Call Pat at 540-798-8104, 540-798-8104. Securities and investment advisory services are offered solely through Equity Services Incorporated, member FINRA SIPC, 4401 Starkey Road, Roanoke, Virginia 24018, 540-989-4600. Now from the Fox Radio Roanoke studios, this is Sisterhood of the Second Act.
Welcome to Sisterhood of the Second Act. I'm Denise Allen Membrano. What happens when you're 50 and you find yourself suddenly single, whether it's due to divorce or the death of a spouse? For women, the financial implications can be scary. Pay inequities often leave women with less monies for retirement, and according to the United Nations, on average, women make 82 cents for every dollar a man earns. Women often take time away from work to raise their children, which can also impact the money they make over their career. Kathryn Matherly is here to tell us how to assess our financial health. She's the manager for the Financial Empowerment Center in Roanoke City. So thank you so much for being with us today.
Thank you for having me.
We appreciate it because people often find that financial subjects of finance is just really scary. It's really stress-inducing.
Yeah.
So how do you help people assess their financial health? What steps can they take to do that?
Well, I like that you use the word financial health, because just like when our health is off, if our finances are off, we can kind of feel when things aren't right. But essentially, usually you want to take the time to go over spending plans, make sure that what your expenses and your income are can match up to one another. And a couple other things too, like your consumer reports, your credit reports, and things like that can always help you just make sure that you're covered where you need to be, make sure that your debts are aligned with your income and all of those things too.
Now, a lot of times people find just that process daunting. Is that something that you can help them with at the Financial Empowerment Center?
Yeah, absolutely. So that is one of the first things that our counselors do when we have a new client. The really cool thing about what we do is that we really take the time to understand a person's situation in that moment or at that first session. And typically through that relationship between that client and the counselor, they're uncovering all of those things that maybe they need to work on or maybe they're already doing really well with. And just helping guide them.
I like that you said counselor because money, it does carry a lot of emotional components to it. It can be a very emotional subject. Tell us more about the center. What do you all do? What kind of services do you offer?
Yeah, so the Roanoke FEC is a city municipality program that Roanoke City has, and they have contracted Freedom First Credit Union as a service provider for the counseling services. So through that, we are able to focus primarily on making sure that our clients are banked, have healthy credit scores and credit reports, help them manage debt, and build savings and wealth. Outside of that, it is a little more than just those four things, though. We do like to make sure that people are receiving resources that they need out in the community. So we're connecting them with community partners. We're also, again, just taking the time to meet them where they are and understand those feelings behind some of their taboo topics around finances.
Yeah, taboo is a good word sometimes, depending on what kind of family you are raised in. Yeah. We are talking with Kathryn Matherly. She's the program manager for the Financial Empowerment Center in Roanoke City. And getting back to suddenly single, what's the first thing we should do financially if we do find ourselves suddenly single?
Take the time to assess where you are. It's really going to come down to what can you afford to continue to have on your plate. You want to make sure that what your income is can afford all of the expenses that you have each month. If they can't, then that's when you probably need to come in and see us and make some adjustments for yourself.
Now, are the steps different if depending on the situation, like is death of a spouse different than a woman finding herself all of a sudden getting divorced over 50?
Yes and no. So in the case of divorce, there might be instances where your spouse would have had access to things like your social security number. And so you'll want to make sure that you're checking your credit reports and consumer reports, making sure that you know of any accounts that are open in your name or have your name on them. So you'll definitely want to take a look at anything that might have your name on them and that you could be held responsible for. And then, of course, if you find yourself as a widow and you're going to have to take a look at who is going to be responsible for those assets and liabilities that are left following the death of your spouse. I would say if there is a will, estate, trust, any of those things for that deceased member of your family, you'll want to take a look at that and see who is financially responsible for everything that person had.
Yeah, because I think paying some bills left behind is not the first thing you think of when your spouse dies.
Understandably so, too. It's a very stressful time in someone's life.
When someone does find themselves suddenly single, the situation may seem dire. Now, if they're not in Roanoke City, can they still come see you? And if not, what kind of tips can you give someone who maybe is not in the area that to find trustworthy financial counseling?
Yeah, I mean, we will never turn anyone away that needs help. So I'd say first step, yes, absolutely come to us and let us have that conversation with you and help you find those resources that you might need in another locality. I say it's the power of Google. We can always try to help you navigate those sorts of situations. If you're just not ready to meet with a counselor too, again, research, Google, all of those things are going to be your best friend should you find yourself in that situation. Make sure that you're reading through any publications or terms of service too. If you are seeking advice from someone else and it's you're maybe not 100% sure about what it is that they're telling you, get someone else to help you. A loved one,
Don't go
a friend.
alone.
Yes, yeah, absolutely. And just make sure that you review them. Make sure they're licensed professionals, certified. And again, you can most of the time Google those things and make sure that that's.
And we are talking with Kathryn Matherly. She is the program manager for the Financial Empowerment Center here in Roanoke. And what kind of red flags should someone look at for if they are seeking financial help and it's not you?
If it sounds too good to be true, that's the number one thing. If they're rushing you, if there's a big time crunch on when you have to get something done, always double check people through the Better Business Bureau website. CFPB is the Consumer Financial Protection Bureau. It's a really good site too. You can file complaints if you do run across something that isn't a legitimate business or if something's not quite right with them. Federal Trade Commission is another really, really good resource if you're looking to make sure that that the company that you're seeking help with is legitimate.
Now, how did you get into financial education? Give us a little background on you.
I'd say two reasons, personal and professional. I started banking very, very young, right out of school. I had a manager take a chance on me and I got into banking. Really, really enjoyed it, but I wanted to do more of an impact with the community. And as I found out more with Freedom First and what they offer the community and how they serve, I really wanted to be a part of that team. Community development is the team that I'm on, and what we do is just amazing. I'm really, really excited to be a part of that team. And personally, I come from not so grand means. I don't come from a well-off family or anything, and I think that financial literacy is definitely something that needs to be more well-known or right. More taught more for everyone in our community.
So what do you find most satisfying about what you're doing?
I think being able to be on someone's journey of success. Off the top of my head, I've had multiple clients go from a very, very low credit score and feeling like they would never be able to achieve their dreams to them inviting me to their home closing after we've worked together for a couple of years. And they're excited and I'm excited for them. So it's just being able to share that with someone and know that I was able to impact that in some small way.
That's a great place to end it. Leave people knowing that there is hope out there.
Absolutely.
No matter what your age, no matter what your financial situation, there is hope. Thank you so much for being with us today, Kathryn. We really appreciate the information that you've given.
Thank you.
And you can see Kathryn's contact information in our show notes at sisterhoodofthesecond.com. Coming up, we're coming out of a worldwide pandemic. How has it changed the way we get our public health information? Dr. Cynthia Morrow is next.
I'm going to be an oak tree.
I think I'll be a dogwood tree.
My kids say they be looking for a thorny tree from me.
With Evergreen, you can be a tree. Our biodegradable urn combines your ashes, natural soil additives, and a native tree of your choice. Be a tree and grow for tomorrow.
I want to be a tree.
Learn more at evergreenmemorialtrust.com.
Pat Lucas is committed to providing independent financial advice to help women and their families save money during this tax season. Call Pat at 540-798-8104, 540-798-8104. Securities and investment advisory services are offered solely through Equity Services Incorporated, member FINRA SIPC, 4401 Starkey Road, Roanoke, Virginia 24018, 540-989-4600. Looking for your first home or retirement home? Realtor Monica Nicely can help you find it. Whether you're moving in or out of the Roanoke region, call Monica 540-449-2019, 540-449-2019. Alcova Mortgage Loan Officer Jonathan Sweat helps you seal the deal with the loan to suit your needs with great rates and terms. Call Jonathan 540-314-8843, 540-314-8843.
Alcova Mortgage, Equal Housing Lender, NMLS ID number 40508, MLSConsumerAccess.org. Terms and conditions apply. All loans subject to credit approval.
Once again from the Fox Radio Roanoke Studios, Sisterhood of the Second Act. Welcome back to Sisterhood of the Second Act. I'm Denise Allen Membreno. Before COVID-19, most of us didn't think a lot about public health, wearing masks, or even lockdowns. Dr. Cynthia Morrow, the director of the Roanoke City and Allegheny Health Districts, joins us now to talk about masking, vaccination research, and what we've learned over the past 3 years from this pandemic. Thank you, Dr. Morrow, for being with us today. I appreciate it.
Thanks for having me.
Now, you don't hear people talking very much anymore about getting back to normal. It seems like everybody's come to the realization that it's like life before the pandemic and life after the pandemic. Still, you still see people out wearing masks. So who should be wearing a mask, and are there times when everyone should wear a mask or consider wearing a mask?
What we're really trying to do now is look at our community transmission levels as the indicator of whether most people should wear masks. And thankfully for us in the Roanoke Valley, we've been in low transmission for several weeks now. I was just looking at our numbers. We're back to some of the lower numbers that we saw in May of last year. So that's really good news. Low confirmed cases, low hospitalizations. We look at our wastewater surveillance, we look at syndromic surveillance. We have lots and lots of indicators, and all of those indicators are showing us that there's no reason for most of us to wear masks because there's just not a lot of COVID activity in our community right now. Now, unfortunately with COVID, we've seen how it changes on a dime. And so if we were to go back to high transmission, we would certainly make the recommendation that people who wanted to protect themselves, who wanted to decrease the risk of COVID, that they would wear masks, but we're not in that situation at this time.
Or even wear a mask because someone you're living with is immunosuppressed.
Compromised. Yeah, and I think that that's where everybody has to understand what their risk threshold is. My 85-year-old mother lives with me, and I've been more cautious than I think a lot of people because I want to make sure that even though she's completely up to date on her vaccines, that whatever risk I take doesn't impact her. So I try to minimize my risks to protect her.
Let's talk about vaccines. Even now, some 2 years after these vaccines were rolled out, people are still hesitant to get those boosters. What's the research showing about their safety and efficacy?
Well, I think that's such a great question. One of the things that has given me great confidence over the last couple of years is our post-vaccine surveillance system that we have in place. So we have a robust system in place that if there were any what we would call signals, so risks, concerns that there was a safety issue with the vaccine, we have systems to pick up that risk right away. And that happened relatively recently where there was a little blip in the signal, meaning that there was a question of whether one of the Pfizer vaccines was associated with an increased risk of a condition. Mm-hmm. It turns out it was coincidental. We look at all of the data and there was no increased risk. But what that has given me is a sense of confidence that our vaccine safety protocols that we have in place to monitor, even after it's been licensed, after a vaccine has been licensed, they're robust, and I have great confidence in them. So I am very confident in the safety of the vaccines that we have on the market. We've seen vaccines being withdrawn because of those signals, right? So we know that the system is there. We know that the system is working. In terms of the efficacy, we have to be honest that this is not the panacea that we hoped it would be. It does not, even if you're up to date on your vaccines, it doesn't mean that you won't get COVID. Mm-hmm. But what it does mean is that your risk of hospitalizations, your risk of getting COVID is still lower, it's just not eliminated. And your risk of hospitalization and death is so much lower. So 15, 16 times lower risk of getting hospitalized if you're up to date on your vaccines.
So who should get a booster, and when do you get your boosters?
Well,
how many boosters should you get in a year?
Well, we're really hopeful that as we have moved out of the acute phase of this pandemic, that and as we've learned more with now 2 years of full vaccine evidence, we're hopeful that we can move to once a year. I think that that's what everyone is anticipating around the same time as flu season. It's possible that, and we have to wait for the FDA to tell us exactly what's going to happen, but it's possible that maybe the highest risk people get 2 doses or a different, for flu vaccines, for example, people who are older get a different, it's recommended that they get a different combination or a higher
I didn't
dose.
realize that.
Yeah. So we'll have to wait and see. We have the FDA, the Federal Drug Administration, which compiles the research, looks at it. And we know, again, that over the last 3 years, they have earned confidence that their systems work. And so we have to wait and let the system unfold. FDA, then the Advisory Committee on Immunization Practices, and then VDH will adopt those guidance if that's warranted. So be patient as we figure out what's to come.
So I think, I don't know if we're learning to be patient, but we hear that a lot.
Yes.
We are talking with Dr. Cynthia Morrow, Director of the Roanoke City and Allegheny Health Districts. And long COVID, you mentioned that boosters help eliminate the possibility of long COVID. What do we know about long COVID now? Senator Tim Kaine talks about his experience with long COVID. Is there anything new that we've learned?
So long COVID continues to be a puzzle, and I do want to be careful. We actually don't think that boosters eliminate the risk. They decrease the risk, but it doesn't eliminate the risk of long COVID. Anyone who's up to date on their vaccines is at lower risk of long COVID, but anyone who gets COVID has a risk of getting long COVID. If you're unvaccinated, partly vaccinated, or if you have severe disease, you're at greater risk of getting long COVID. And the reality is, and I know that this is frustrating for a lot of people, we're still learning a lot about long COVID. We don't have a lot of good evidence. It's a very wide definition, very wide range of symptoms that people have, very wide range of how long it takes to resolve. And so we still have a lot of learning to do when it comes to long COVID.
Yeah, it is amazing how different these cases can be.
Yes.
So you mentioned a little bit about tracking earlier. How are you all tracking COVID cases since a lot of people test at home?
That's a great question. So in January 2022, which was our most significant surge to date, we were getting over 700 cases of COVID reported to us a day.
Wow.
Now we're down to less than 10 a day. But at the time, there wasn't widespread availability of home tests. Now there's widespread availability of home tests. People don't need to go to get a PCR test done. You can, if you're sick and you're worried you have COVID, you can take a home test. We're never going to hear about those results, and that's okay. What we now do is rely on tracking. We look at our hospitalization data. We look at our wastewater surveillance data, which people sample the wastewater and study it to see how much virus is in it. Wow. And we do something called syndromic surveillance, where we look at, of the people coming to the emergency department, how many of them have fever, cough, the symptoms that are consistent with COVID.
So after this pandemic, anytime you're in a health emergency, communication is key. What did you all in the public health industry learn about communication during the pandemic? What do you all need to do differently in the future?
I think there are always opportunities to improve. I think that in the beginning, there were a lot of mixed messages coming from a lot of different people. We need to be transparent. In the beginning of any new disease outbreak, we have to admit that we don't know yet what's going on, and we just talked about patience. We have to be honest that the information is evolving. Our guidance is going to change as our information changes. As we gain more knowledge, as we gain more wisdom, our guidance is going to change. I don't think that we collectively did a good message. So when at one point we're saying, oh, nobody needs to wear a mask, everybody needs to wear a mask, everybody stay home, oh, maybe you don't need. It was very confusing, and I think that we could have done a much better job at saying, we don't know yet. These are the steps that we're going to take to optimally protect health the best way we know how. And this message is going to change as our information changes.
So why did you get involved in public health?
I've been extremely fortunate in my life. I went to medical school and I got my public health degree at the same time. But at the end of the day, the main reason that I got into public health was because I saw so many gaps in our system, and I was treating people in the office who had so many barriers that were preventing them from living their optimal health life. And I had a heartbreaking situation where there was a woman who had terminal cancer, and I, by her side, advocating for her, still had difficulty getting her the care that she deserved. And that was when I decided it's time for me to try to look at the systems, try to look at the public's health, what we can do to work together. Healthcare departments, public health departments, media, schools, how can we all work together to assure that people can live their healthiest lives?
That is, it's amazing how I think Carolian did zip code studies and the difference in the quality of health care from zip codes. So to wrap it up, what does public health need to do, or what do we need to do to make sure we have a strong foundation for our public health system?
I think one of the things that just historically we have underfunded public health, and I know that that's challenging, but what happens in public health is we get a lot of funding to react to COVID, and then that funding goes down, and we don't have enough to do some of the important work between crises, let alone be optimally positioned to respond to a crisis. And so there's a lot of work going on now to improve the public health infrastructure, and I think that's the right direction to take.
All right. Dr. Morrow, thank you so much for being with us today.
Thank you for having me.
You can get the Roanoke City Allegheny Health District's information on our website at sisterhoodofthesecond-act.com. We'll be back to wrap up the show after this.
See where a grateful nation remembers its heroes, and where Thomas Jefferson came to relax. Where small town charm is just down the road from big outdoor adventures. Find peace and quiet, as well as the sounds of family fun. Destination Bedford is located where the Piedmont Plateau meets the Blue Ridge Mountains of Virginia. Where ordinary ends, Bedford begins.
In a region known for its beautiful mountain surroundings, our vibrant arts community makes the Allegheny Highlands a more colorful place to live and visit. Our passion for the arts is endless, and it's uniquely Allegheny.
I would like to thank Kathryn Matherly and Dr. Cynthia Morrow for being with us today. Kathryn showed us that no matter what your financial situation is, you can improve your financial health. Dr. Morrow talked to us about public health and what they learned from the COVID pandemic. I'm Denise Allen Membrano. We'll see you next week for another edition of Sisterhood of the Second Act.